Great, thank you so much. My name is Nicole Golbari. I'm the surgical fellow at UC Irvine, and today, under the guidance of Dr. Chris Zachary, I'll be presenting clinical endpoints with the long pulse 532 and 1064 nanometer laser. We've heard a lot about this laser over the past weekend. It's a novel device and really great. And while there are suggested device settings on the machine, it's really important that we, as clinicians, understand how the laser interacts with our tissue to best achieve our clinical endpoints. The laser has really two unique features. The first being an intelligent cooling design, which allows the clinician to alter not just the pre, but also the post-cooling. And the second being the variable sequential pulsing, which allows you to give one true full single pulse, or to break up that pulse into sub-milli and sub-micro pulsing. In this way, particularly with the sub-milli pulsing, we can mimic the pulse dye laser. Here's a great example of a port wine birthmark treated by Dr. Susie Kilmer. You see the PDL is treated on the top part of this lesion and the derma V at the bottom. We see less immediate bruising with the derma V laser, but similar efficacy and long-term results. So when we look at our vascular lesions and we're looking for the tissue interactions with the 532, there are three things we're really looking for. The first is a transient blue-gray color that appears when treating vascular conditions. This only appears for a couple seconds and typically dissipates after that. The other thing you might see is a disappearance or a contraction of a vessel, and this is correlated with intravascular coagulation. This also can persist or can move on after a couple of seconds with higher flow vessels, particularly around the nose. Here's an example of that. And lastly, you can get a traditional purpuric response, typically seen with shorter pulse durations. Here's a quick video demo of us using the 532 on these chin vessels. And right after the pulse is given, you'll be able to see this blue-gray discoloration. As I mentioned, it's transient, and it's really important to distinguish this clinical endpoint from epidermal whitening that you might see from necrosis that you might get if your fluences are too high. In some cases, a pulse may heat up the adventitia enough that you can get vessel contraction, but not enough to achieve true intravascular coagulation. This device, with the intelligent cooling design, really allows you to stack pulses. One pulse alone will get that vessel contraction, and once you get that second pulse, you'll get intravascular coagulation that you're looking for. This was first described by Tom Rohrer using the pulse dye laser, but in our clinic with the Derma V532, we like to call it the Zach stack. Here are some nice results you can see from test spots treated on the superficial leg vessels. Patient was very happy, but came back and said, "You missed a spot." So. Here, an important caveat when treating this laser is, with this laser is that you might get a little bit of swelling, particularly with shorter pulse durations. Here, this patient was treated with a 6 millisecond pulse duration, and you can see at 36 hours she did have significant swelling. This tends to dissipate over the next, usually 48 hours after treatment, and we found that with longer pulse durations, typically 10 milliseconds or higher, this is less of a risk. When you're treating deeper, larger venous targets, you're going to switch over to the 1064 nanometer. The endpoint here is less of an epidermal change. You don't want to see that blue-gray response. Instead, what you're looking for is a disappearance or significant contraction of a vessel. For larger vessels, you may not get that disappearance. Instead, you can appreciate some hardening of the vessel that you can palpate usually about 30 to 60 seconds after a pulse is given. Here we use the AccuVein to identify the target vessel, and you can see right after treatment, vessel is gone. And here's in this video, you can see really satisfying disappearance of the vessel with every pulse. Ideally, you want to collapse the vessel as much as possible. This is more difficult to accomplish with larger vessels, veins in particular, as you can see in her upper leg. But if you can imagine, if you were to feel this patient's leg, this was about 30 seconds after treatment, this felt much harder than the non-treated vessels adjacent. Here's an example of a vascular malformation where you might use a 532 nanometer. Here we use sub-milli pulsing, versus a larger, deeper vascular malformation where we use the 1064 with a true single long pulse. We actually went up to 60 milliseconds in this case. Seems to be good resolution despite the small area of scarring from the biopsy site where that was performed. For pigmented lesions, you're going to look for different clinical endpoints. You want to look for immediate, subtle darkening of the treated lesion. And for superficial seborrheic keratoses, you might see some slight scaling. These are smaller, more superficial targets, so you're going to use lower fluences with shorter pulse durations, typically submicro, and no pre-cooling. Here's a great example of immediate darkening right after treatment. And here's some pre- and post-treatment results of lentiginase. The thing you want to warn patients about or just advise patients about is in addition to that immediate darkening, typically 2 to 3 days after treatment, patients will notice flaking of the treated lesions. We call this a coffee ground appearance, and this tends to disappear about 7 to 10 days after treatment. Here's an example of SEB-K treatment pre, 2 days post, and then 1 month after treatment. You lose longer pulse durations and more heat with the seborrheic keratoses. So in conclusion, this is a great device. It really gives you great options for treating not just vascular, but also pigmented lesions. The important thing is understanding your settings and really understanding your endpoints. We want to understand that tissue laser interaction to not just give our patients the best clinical results, but also reduce their adverse side effects. Thank you so much.